to my Generations in America project. Um, we are recording this from my room. Unfortunately, it is not at Lasell University, where I'm a senior in psychology. Um, but yeah, so today we are going to be looking in careers in aging, geriatric social work for my Generations in America class. And yeah, so if you guys don't mind leaving a like before we start, that would be awesome. Um, and I will begin now. So, all right. So these are just some of the statistical data that I have found from the geriatric social work research that I've done. So the first point that we have is healthcare social workers underemployment is expected to rise 20% from 2016 to 2026, and then of course go up beyond that after 2026. So yeah, I thought that was pretty interesting. The next point that I have is geriatric social work is one of the number one in demand jobs right now in America. Um, and the population of people over the age of 60 has risen from 378 million in 1980 to 759 million in 2010, which is a pretty big, significant jump considering all of the baby boomers are now over 60 years old, and they are in need of more health care and assistance. And finding employment is possible through government agencies and facilities, and through hospitals, nursing homes, community centers, and other establishments that are used for the older generation. So the one place that I found among a lots of positions was geriatric social worker at Maine General Health. Um, their description is Maine General Health is a leading healthcare system that is proud of the culture and of excellence, compassion, and collaboration that exceeds our patients and their families. Um, we are committed to attracting people uh, who share our values and strive to provide excellent customer service. We are offering an exciting full time opportunity for an individual to join our team as an LSCW or LCSW, sorry. Um, and so I have right here the LinkedIn page for this. So this is the LinkedIn page right here. As you can see, all that fun stuff. And then we also have, the ideal like qualifications that we'll get into some of these, and we'll get into other qualifications that other opportunities have stated that are required. Have good judgment, the ability to, and then um, the ability to work independently, um, and yeah. So and then we'll also talk about um, the salary and some of the skills and how some of those skills have tied in with what I've learned through other places that I've worked at and internships. So Back to the presentation. All right. So first, we need to figure out what a geriatric social worker is. Like, what exactly is the position? Because you hear, oh, this such and such person is a social worker, but you don't exactly know what they do. So we're gonna kind of break this down just a tiny bit, have a general idea going forward what this is and what the qualifications. Um, so a geriatric social worker helps the everyday need of the older clients that they work with. The social workers help the individual people that they work with to adjust and to cope with problems that just overall issues that they may be having, both physically, cognitively, and even financially. That's just basically an overview of or description of what they do. Their salary is normally above 60,000. For the position that I found, it stated that it was 53, but the range can be from 44,000 to, I think it said like at least 70,000. So it's definitely there's definitely a range of what you can have for a salary. You also need a current Board of Social Work license as a clinical social worker. That's required to work in this position. Also, master's degree in social work is preferred as well. And a lot of this stuff doesn't just connect with gerontology and not just for social work. So some of the skills that I have that are also kind of needed for this job that are just kind of general skills, but also skills that you learn through experience, etc. I've learned this through school. I've learned this through high school, middle school, elementary school. Taking using that is very, very important. The ability to create therapeutic relations through discussion and feedback. I have learned this through my internship and through my other jobs as well. I used to work at a camp and through Mission Safe with the youth at Mission Safe too, and the staff. We always had supervisions where we would talk to our supervisor and we would tell them our problems, tell them how we're feeling, and they would provide that feedback, and it would create that relationship, and it would create something that was usually like not therapeutic, but it was informative, enforcive. Um, there's positive feedback, negative feedback, mostly positive, but especially when I worked at the camp, that was all negative feedback. But I'm not going to get into that. Um, the organization and multitasking skills. Learn this through doing schoolwork, and just organizing everything with schoolwork, organizing things in internship, organizing things, with working the job fields, all that fun stuff. Effective oral and written communication. That is something I've also learned through many, 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 many different um, ways of just trying to work in different areas. Even for a lot of people in any field, having oral and written communication is key, and it's something that helps in the long run. And then also master's degree and a Maine State Board of Social Work um, license. So I kind of have breaking this next slide down, into two parts. Um, how I would be good for this position and why I'm not qualified. Uh, So the first one is why would it be good for this position? Because I have the ability to create therapeutic relationships with other people through my previous experiences, um, working at Mission Safe as an intern, working at the camp, working at just my everyday job. So it's something that I've just kind of learned over the years, and it's helped me a lot. I'm very experienced with using Microsoft Office products, Word, Excel, and PowerPoint. And supervisors would say that I'm a very organized person and I am able to bring new and fresh ideas about various things and being able to speak out about and be oral and be effective about it. Um, and so, why I'm not qualified for this position is because I do not have the proper education to pursue this, nor do I have the degree. Um, I'm sure after I have my degree in psychology, I could go for a master's degree in social work, but that's something that I don't see myself in. I mean, I could, but it's just something I personally do not see myself in. Um, I do also do not have a social work license. That's required for anybody that goes into social work. And also, I do not have the experience with working with the older generation. Mostly work with youth, anywhere from ages 6 to 17, 18. Um, and I've worked with people who are my age too. I don't know if that counts, but yeah. So just just the experience overall is something that I don't have um, with older people. But that does not mean towards something like that. And that's what I'm going to get to next is how can I proceed? How can I work on trying to find ways to become a geriatric social worker? The first way is schooling. Um, there are a few I found in Massachusetts and Connecticut. Um, the first one is William James College. They have a program. Um, there's a 2-year program at UMass Boston, um, and that's a full time. And also the next point that I want to get into, not only for this field, but for other fields as well. Even if you're not going to college or not going to um, be like continuing on with schooling and education, is experience. Having experience on your resume, having those skills and those ways of trying to better yourself, I think is really, really important. So experience through volunteering. You can volunteer in senior centers, and you can volunteer your time with just older people and organizations that deal with older people. Internships, interning at hospitals, interning at places that work with the older generation, interning at nursing homes, just having those experiences while you're young really helps. Um, and just finding related jobs that may not be the same thing, but you can still apply them to other types of jobs. So, say I did want to go into geriatric social work, and I didn't have that licensure yet, or I didn't have the proper schooling yet. I could go and work at a hospital and be a mental health counselor, or I can be just working in hospitals as other things before I um, pursue the the field that I would want to go into. And then it's the same thing with jobs that don't even require um, things with degrees. Like you can work at a grocery store, and you can have the experience, and you can put that on your resume. And then just related jobs that give you the skills to do those things for future jobs is really, really important. Alrighty, ladies and gentlemen, this is the end of my presentation. I will also put these sources in the description box below. You can click on the links, or you can copy the links, and you can just look and find more information on geriatric social workers and what they do, and just all that other stuff. So, all right, everybody, please stay safe in this time of in sickness. Be healthy. Wash your hands. Just overall, please be safe. And I hope this PowerPoint and me talking in some way has educated you, or has just lit in something in your head that really stood out. Make sure you leave a like, and please stay safe. So I will see everybody next time. Bye for now.